There's a lot of confusion about what the feline leukemia virus does in the body, how we test for it, and what those test results mean. So that'll be the main focus of this video. I'll also chat about the virus in general, which cats are most susceptible, symptoms, treatment, and prevention. So let's chat about the feline leukemia virus in cats. I'm Dr. Osk, cat veterinarian since 2004. How common is feline leukemia? Generally speaking, feline leukemia affects between 2 and 3% of cats, but this can vary considerably based on your location. The disease has decreased significantly in the past few decades due to vaccines and education. A big reason why we don't like this virus is that the virus can be passed relatively easy through saliva. So that means common cat behaviors like mutual grooming or sharing food and water dishes are ways the virus can be passed from positive cats to negative cats. The biggest risk comes from exposure or contact with an infected cat. Kittens and young cats are the most susceptible. As a cat ages, their immune system gets stronger and an infection is less likely. Many studies have shown that as cats age, they develop a sort of a natural resistance to a feline leukemia infection, but this is not a guarantee. Any exposure or contact with a positive cat, no matter their age, can result in an infection. Any contact with infected saliva droplets can result in transmission of the virus. The virus can also be spread with other bodily secretions like discharge from the nose, urine, feces, and milk, or from bite wounds while fighting. The virus is not super contagious, and oftentimes prolonged contact with a positive cat is needed before the virus is passed to a negative cat. A mother can pass the virus to her kittens both before they are born and while they are nursing. The virus really doesn't survive too well outside of the body, so picking up the virus from the environment is extremely unlikely. When the virus enters a cat's body through the nose or mouth, if there are no checks and balances, the virus infects nearby lymph nodes. Think in the back of your mouth where the tonsils are, or your glands in your neck when you have a cold. There, the virus infects white blood cells by inserting itself into a cat's DNA and travels to different parts of the body with the goal of a permanent residence in the bone marrow. Once the bone marrow is infected, the virus can keep making copies of itself and re-enter the bloodstream by inserting itself into other white blood cells and platelets. But that just doesn't happen each and every time because the virus has checks and balances, namely a cat's immune system. Depending on the exposure and how strong a cat's immune system is, there are 3 primary outcomes. The first outcome, called an abortive infection, occurs when the immune system is strong. The immune system stops the virus and prevents an infection. The virus never makes it to the lymph nodes and never infects white blood cells. A cat is never infected with the virus. The second outcome, called a regressive infection, occurs when there is a partial immune system to the virus. The virus makes it to the lymph nodes and infects white blood cells. It travels to other parts of the body, but the immune system, in most cases, stops the virus from infecting the bone marrow. Cats in this category are not shedding the virus in their secretions, will not infect other cats, and generally do not show any symptoms. The only exception is that cats in this category can infect other cats with a blood transfusion. The difficult part about this outcome is rarely. The virus can reactivate down the road if the immune system is weakened or suppressed, like with medications or another disease. If this happens, they can infect other cats and may begin to show symptoms related to the feline leukemia virus. The third possible outcome, called a progressive infection, occurs with a weak immune system. This is the worst possible outcome as the virus infects the bone marrow, makes copies of itself, and infects platelets and other white blood cells. These cats can infect other cats because the virus is in the saliva and other secretions. These cats also show symptoms. One distinction I would like to make is that in humans, when we talk about leukemia, we are generally referring to a blood cancer. When we talk about leukemia in cats, we are talking about a virus, the feline leukemia virus. The virus can do a bunch of different things within the body, and causing cancer is one of them. Over time, the virus can weaken a cat's immune system, resulting in secondary infections like an upper respiratory infection. Other symptoms that will depend on a cat's immune system and where the virus is in the body may include weight loss, decreased appetite, fever, poor unkept coat, big lymph nodes, pale gums from being anemic, inflammation of the gums or gingivitis, inflammation of the mouth or stomatitis, eye issues, inflammation in the digestive tract that can cause GI symptoms like diarrhea, neurological issues like behavior changes or seizures, and kitten abortions. As with any unwell cat, many of these symptoms can result from many other illnesses and are not specific to the feline leukemia virus. Cats in Category 3, progressive infection, are the most unwell, have the most symptoms, have the worst prognosis, and typically do not live as long as cats in the other two categories, generally only 2 to 3 years. The Feline Veterinary Medical Association recommends testing all cats at their first visit, 4 to 6 weeks after a known exposure, before vaccinating against the feline leukemia virus, and in any unwell cat showing any of the previously mentioned symptoms, even if they tested negative in the past. I'm going to chat about 3 feline leukemia virus tests: an ELISA test, a PCR test, and an IFA test. How we use these 3 tests to determine which of the 3 categories your cat is in, and just as your head starts to hurt, summarize everything in a chart. The first test is the in-house or point-of-care test, known as an ELISA test, which is commonly run at every vet office and hospital. Results take about 10 minutes, and this is a great screening test. The test is looking for the virus, specifically a viral protein floating freely around in the blood. This test is typically positive 3 to 6 weeks after an infection, but it may take a bit longer with some cats. The second test, the PCR test, is looking for proviral DNA in the blood, is much more sensitive than the ELISA test, and is generally used as a confirmatory test. This test can be positive 1 to 2 weeks after an infection. Some tests are quantitative, meaning they measure the amount of virus in the body. Knowing these levels can help determine which category a feline leukemia positive cat is in. In this video, I'm going to focus on the proviral DNA test, as other tests exist like a PCR test looking for feline leukemia virus RNA. The third and final test is the IFA test, which looks for a virus protein within platelets and white blood cells after the virus has infected the bone marrow. It can take 45 to 60 days after an infection for this test to be positive. This test is usually positive 3 weeks after an initial positive ELISA test. We have our tests. Now let's chat about how each of these 3 primary feline leukemia outcomes can affect each of these tests. We start with number 1, abortive infection. These cats do not test positive using ELISA or PCR test and do not show any symptoms. The only way we know these cats were briefly infected with the feline leukemia virus is because they have antibodies against the virus, which means the body recognizes the virus even though these cats test negative. Up next, number 3, progressive infection. Since the virus has infected the bone marrow, makes copies of itself, infects platelets and other white blood cells, and enters the blood again, all 3 tests, the ELISA, PCR proviral DNA, and IFA tests, are positive and remain positive. If the PCR proviral DNA test gives quantitative levels, persistently high levels are generally found. The IFA test will only test positive after an established bone marrow infection, which can take weeks. That means interpreting this test can be tricky, since we do not know when the infection occurred, and most cats in this category eventually will test positive. I've saved the most confusing category for last. Number 2, regressive infection. The partial response by the immune system does not eliminate the virus completely from the body, staying in the lymphoid tissue, and the virus generally doesn't become established in the bone marrow. Initially, right after the virus enters the body, many of these tests will come up positive. However, over time and depending on a cat's immune system, levels of the virus protein and the virus DNA start to decrease, and levels may drop so low that the ELISA and/or the PCR Proviral DNA test cannot detect the virus anymore. Oftentimes after the initial infection, cats only test positive for the PCR Proviral DNA test, while the other tests remain negative, but this is not a hard fast rule. If the PCR Proviral DNA test gives quantitative levels, low levels are generally found. Cats with a positive PCR Proviral DNA test can transmit the virus to a negative cat through a blood transfusion. If the virus is reactivated down the road, these tests will be positive again, and this can occur years after the initial infection. Most cats in this category will test IFA negative. As you can see, whether or not your cat tests positive on one of these three tests really depends on when your cat was infected, the stage of the virus in the body, and how strong or weak a cat's immune system is at the time of the test. A negative test today can show up positive as the virus progresses in the body. A positive test today can be negative as the immune system gets the upper hand. If you are still with me, let's chat about real-world applications of these three tests. And in doing so, hopefully this will put everything together and make a lot more sense. And we start with that initial screening test, the ELISA test. What do we do if that test shows up negative or positive? If your cat tests negative on the initial ELISA test and there is a low chance of exposure, we generally believe the negative test and we are done. If your cat tests negative and there is an unknown previous exposure or a high suspicion of exposure, like your cat escaped and was missing for a few days, was in a fight or has a wound, you're not quite sure how they got it, retest in 4 to 6 weeks to see if your cat tests ELISA positive. If your cat tests positive on the initial ELISA test and the feline leukemia risk is low, we want to confirm that positive test result with another test because false positives can and do occur, especially in cats not really at risk for getting feline leukemia. You have two options: run a different ELISA test from a different manufacturer or run a PCR Proviral DNA test. If your cat tests positive on the initial ELISA test and the feline leukemia risk level is high, or tests positive on a 4 to 6 week recheck, we need to confirm that test with either a PCR Proviral DNA test, an IFA test, or a referral laboratory antigen test, similar to an in-house ELISA test, just more sensitive and more accurate. If any of these confirmatory tests show up positive with the initial ELISA positive test, we have just confirmed a feline leukemia infection. Now, if we have a positive ELISA test and a negative confirmatory test, we are unsure of a cat's feline leukemia status and will need to retest in the future. And when this happens, this is super frustrating and really represents the complex nature of the virus. If you run a quantitative PCR Proviral DNA test, high levels can suggest number 3, a progressive infection, while low levels can suggest number 2, a regressive infection. There are only 2 scenarios where a feline leukemia diagnosis is easy. If all of the tests are negative and there is a low risk of exposure, that cat is negative, they never saw the virus or were in category number 1, had an abortive infection and completely cleared the virus from the body. If all the tests are positive and there's a high risk of exposure, that cat is infected and in category number 3, a progressive infection. Any other scenario, negative cat with a high risk or unknown risk of exposure, cats that test positive on some tests but negative on other tests, time is the enemy and we'll have to wait and see what future test results say before we can determine which category your cat is in. Now, I don't want you to get too bogged down with the details, and there are many more details with this virus. Leave that to the professionals. The big takeaway here is, if a cat shows up positive on that initial ELISA test, assume they are infectious to other cats. It can take some time, especially when those confirmatory tests go against that initial positive ELISA test, before we can determine which category a cat is in. Number 2, regressive infection, or number 3, progressive infection. To make matters worse, each of these tests can have false negative and false positive results, making diagnosis a real challenge. When it comes to any retrovirus, testing is key for an accurate diagnosis. Even the type of sample can affect the test result. For example, serum and plasma are more accurate than whole blood for the initial ELISA screening test. This is the basic, generally agreed upon approach to feline leukemia testing that is out there. These 3 tests and some other tests I haven't chatted about may or may not be available in your area. We can even use other bodily secretions like saliva with some tests. So your vet may recommend a slightly different approach to the one I've chatted about here. There is no definitive treatment or cure. Treatment is mainly focused on secondary issues that arise, like an antibiotic for a bacterial infection or a transfusion for anemia, not the virus directly. Simply having the feline leukemia virus is not necessarily a death sentence. Many of these cats can live for years as long as they are kept inside 100%, are spayed and neutered. Stress is minimized, they have good nutrition, and they see a vet every 6 months. Euthanasia will most likely be discussed for cats in category number 3, progressive infection. Because these cats show symptoms, they have a poorer prognosis and are infectious to other cats. Cats in category number 2, regressive infection, can have many good quality years as an indoor-only cat. However, they should probably only live with other feline leukemia positive cats as long as there is no fighting, or be the only cat in the household. The really cool thing is there are feline leukemia specific cat rescues in homes that provide a safe, dedicated space for feline leukemia positive cats to live out their lives, or they have programs to help feline leukemia positive cats find their forever homes. Prevention is done in 3 ways: identifying feline leukemia positive cats, segregation, and vaccination. Testing all cats, especially at their first visit, and 4 to 6 weeks after a potential exposure, is key to identifying positive cats to minimize transmission of the virus to negative cats. Segregating cats can only occur if we know which cats are positive. And keeping those positive cats indoors, away from negative cats, is the only 100% guarantee to prevent transmission. Vaccination can be very helpful, but it is not a 100% guarantee. Because kittens are the most susceptible and the virus can spread through saliva, the feline leukemia vaccine is considered a core vaccine for all kittens, which means each and every kitten should have the initial vaccine series, 2 vaccines, 3 to 4 weeks apart, and a 1-year booster after the initial series. After that, the vaccine may be discontinued based on your cat's lifestyle and their risk of exposure to the virus. And since these tests are looking for the virus, not antibodies, vaccines will not falsely cause a test to be positive. As already discussed, the virus does not survive in the environment too well, and most household cleaners are effective at killing the virus. That was a lot. If that seems confusing to you, that's because it is. Retroviruses are tricky. Testing is not always straightforward. As we continue to learn more about the feline leukemia virus, testing and recommendations will continue to change. And just when you thought we were done. Earlier, I said 3 primary outcomes. So to make this even more confusing, there is a 4th, rare possible outcome called a focal infection. That's where the immune system keeps the virus sequestered in a specific organ, like lymph nodes, the spleen, mammary glands, digestive tract, or urinary tract. We use this category anytime test results just don't make sense, and we cannot grow the virus from a cat's blood. ELISA test results are low positive at random. Proviral DNA tests can be negative or low positive, again, randomly. We don't think this is a big issue, and cats in this category are probably not spreading the virus too much. This category is rarely used to explain test results that just don't make sense or fit nicely into the other 3 primary categories. The big takeaway here is to keep testing and retesting, especially when results don't make sense. And any cat that tests positive on that ELISA initial screening test, assume they can spread the virus. That's it from Meow. If you learned something, like, subscribe, and comment. For more cat information, check out my YouTube channel, Cat Chat with Dr. Osk. Thank you so much for watching, and I will see you on my next video.